Hi, it's Kristen here at UT Southwestern Medical Center. Thank you for tuning in today to talk about breastfeeding. If you are on the Gulf Coast, we want to, let you know that our thoughts and our prayers are with you. We're here for any way that we can. Today to talk about breastfeeding, we're happy to have lactation specialist Mandi Longoria and Linda Catterton. Both are registered nurses here at UT Southwestern. Before we start, I want to say special thanks to Parkland Hospital as well as the Texas Breastfeeding Coalition for helping us promote the chat by sharing it with their groups. We really appreciate it. As we move through, don't forget to like and share the conversation and ask your questions in the comments section. If you start to have audio issues, please hit refresh and that should solve that problem for you. But otherwise, let's get started. So ladies, we're really glad to have you today.
Oh, thanks for having us.
So one of the first questions is what are the recommendations for breastfeeding when you're a new mom?
Well, the recommendations is for the baby to be breastfed exclusively for the first 6 months of life, meaning no infant formula, no cereals, as long as there's no other medical indications to need that.
Okay.
And then up to 2 years beyond that, with being able to get table foods and things of that nature.
Okay. So what are some of the benefits to moms who breastfeed?
Mothers have lots of benefits, just the protection that it gives against breast cancer. It is a way to lose weight. It's a great way to bond with your baby. There's just a lot of different, even protecting against diabetes.
There are also benefits for the baby, correct?
Oh yes, absolutely.
I mean, I've heard that babies who are breastfed, at least somewhat, get sick less often. Is that accurate?
Yes, it is accurate. And the reason behind that is all the immunities that moms get and have towards different colds and the resistance that they have then is transferred through that breast milk to the baby. And so it does help in protecting them from getting sick more.
Even the colostrum has immunizations that the babies wouldn't get any other way except from the breast milk.
Right. Awesome. Well, I know one of the questions that came in before our chat was from Raquel Martin. So Raquel, I hope you're tuning in now. She says she'd love some tips on weaning her son to prevent clogged ducts. I mean, what are some ways we can help her with that?
Yeah. Sorry. One of the best things to do with weaning is to go slowly. Don't do cold turkey weaning because that is going to cause a lot of tenderness, soreness, and puts you at risk for a plugged duct, for mastitis, and things of that nature. So what you're going to want to do is to begin dropping feedings every couple of days. So you may have 4 feedings during the daytime. So you may start feed in the morning, drop your afternoon feed, and then you would feed. Do that for several days, and then drop another feeding after about 2 or 3 days.
Okay.
Usually you want to drop the baby's favorite feeding last. That
really?
way they don't.
Favorite?
Yes.
Okay.
Drop it last.
Last.
Gotcha.
Not first.
Not first.
Okay, last. But doesn't that make it, if it's last, I mean, that just seems a little counterintuitive in a way, that if it's their favorite, then that's going to be the hardest for them to let go? Maybe?
That's kind of the rationale.
Okay.
That's the one they like the best. That's the one you hang on to the longest.
Okay.
Yeah.
All right. So how long let's see, we've got some people tuning in. Hi, Veronica and Reggie. They're wondering, how often should I breastfeed, and how do you know that your baby's getting enough milk?
Okay, the babies really, you pay attention to what they're communicating, and they let you know when they're hungry. They're looking for their hands. They're looking to suck. That suck is an indicator that they are ready to feed. So to feed as often as they want, as long as they like, is how the milk supply is established and how you feed them. And you know they're getting enough. The main thing is weight gain, but even from the wet and dirty diapers, it indicates they're getting what they need.
Okay.
And a big part of feeding too is going to be making sure to feed them with the first cue of hunger. We don't want to wait until we're at the point of crying. If they're at the part of being mad and angry, then they're at the hangry stage.
Yeah.
And how I like to relate that to my patients is saying it's very similar to if you've gone to your favorite restaurant and you say, I want to sit down and eat. then you have to wait an hour and you sit down to get your food and they're out of what you want. By the time they bring you what they have to make up, then it becomes you're, sawing at your food and eating and nobody's hungry, ready to throw biscuits against the wall. Well, if you're taking that baby and getting them to that point, then they're not going to want to have to work to do what they need to do.
Okay, well, one of the questions that women ask a lot is they say, I have small breasts. How am I going to produce enough to feed my baby? Is that an accurate fear?
It's not really an accurate fear, but it is a fear that we hear a lot. Women with smaller breasts still have plenty of mammary glands. They, as long as they are feeding the baby on demand and as much as they want to be fed, then their body should produce what is needed to be able to provide for their baby.
Okay.
And in that first couple of weeks, the prolactin level is high. So as they feed, it's the prolactin that will determine how much milk they make, how much milk their breast can store. So that even makes a difference.
So is there, you mentioned earlier kind of feed on demand, is there a time length that people should consider? I mean, because I know some women, I'm just going to say this, I breastfed all 3 of my kids, and with some of them I felt like that's all I was doing all day long. I mean, are there any guidelines for that?
Early on, that is pretty much all you do. But then babies learn how to be more efficient at getting the milk. So then after about 6 to 8 weeks, it doesn't take as long because they are more efficient.
Okay. So we've got one of our questions that's coming in, wondering, it's Crystal. She says, does breastfeeding help you lose weight? And that's, I'm sure you guys get that a lot.
Yes.
And it does. Question. You actually burn about 500 calories a day with breastfeeding. You actually burn more calories with breastfeeding than you do with pregnancy.
Right.
So, but you need the calories for milk production. So sometimes it will be that 3rd, 4th month before you actually lose the weight from breastfeeding.
Right. And you can not lose weight if you're not eating a healthy diet. You still have to have a healthy diet, but if you're going to try to lose weight, then you need to make sure that you're getting enough calories for you and for your baby.
Right. So with that in mind, and this had come in before, they say, can you drink, is it safe to drink caffeine while breastfeeding? Because clearly, it doesn't always have calories in it, but what is the stance on that?
Well, caffeine is okay in moderation. Anything that you have when you're breastfeeding is typically okay in moderation. You don't want to only drink caffeine. You need to be drinking a lot of water. You need to be drinking and eating a healthy diet. And if you have a coffee, probably don't want to get 3 or 4 coffees in a day with extra espresso, even though you're exhausted and tired. Because it's going to, it works like a diuretic, so it could cause the supply to not come in as much as they need it to.
Okay. All right. So good question, Crystal. So don't forget, so when you're tuning in, be sure to write your questions in the comments field and we will keep taking them. We've got some more rolling in. So the other question are, this is, I have breast implants and have had a breast reduction. Can those women still breastfeed? Does it depend on the person?
Well, implants, typically they can. Sometimes they have, some surgeons do the implants where they remove half of the areola. And that is where nerve endings occur. So you have to, there could be a risk factor if those nerve endings have been severed. And that is the case typically with the breast reduction surgery. Because they've actually removed the areola, they've cut underneath the arm where they're actually cutting the nerve endings. So that puts the mother at risk for low milk supply.
So if they've had the reduction too, the doctor doing the reduction isn't able to differentiate between the adipose glands and the mammary glands. So it could be inadvertently pulling some of those glands out as well. So, but does that mean that you can't breastfeed? Absolutely not. It means that we're going to go and work with what we have to make sure that you're able to get to your goals.
Okay. All right. So another thing, I know a lot of people struggle with breastfeeding. They just struggle with breastfeeding. I mean, is it an all or nothing proposition where, you have to exclusively breastfeed?
No, absolutely not.
No. Breastfeeding is, for us, our role is to educate and provide the best information to give you the tools to move forward and to meet your goals that you have. Now, if you make the decision to breastfeed or to pump exclusively or to breast and bottle feed or bottle only feed, we as lactation consultants are still going to provide that support and that education that you need, just like we would with any other disease process, or not their disease process. That's a bad analogy, but any other issue.
Yes. Okay. So we got a question from Christy. She says, "Are you lactation specialists?" Yes, Christy. These are 2 lactation specialists at UT Southwestern. We have Mandi Longoria and Linda Catterton, who are both registered nurses and some of our crackerjack lactation specialists.
Yeah.
So we're going to go on. We've got another question from Jessica Wrong. So she says, "Is there something I can do to prevent clogged ducts?" She has one in the same place repeatedly, at least once a month. How can we?
With plugged duct, biggest thing is that's occurring because that gland is not able to empty like it needs to.
Okay.
And so it just kind of builds up and then gets plugged. So you want to make sure that you are feeding frequently, you are positioning the baby to where they're putting pressure on that duct, and just making sure we're emptying as much as we can with that.
And there's more. Yeah, new research has just come out in 2016 that talk about therapeutic breast massage, and if you take the heel of your hand and massage up toward the axillary, and then hand express, that can help to resolve plugged ducts. Another thing is if it does continue to occur, you might check with your doctor about taking lecithin, and that will emulsify the fat and possibly prevent any more plugged ducts.
Oh, interesting. Really great question, Jessica. So we've got one from Lori. She says, this is a comment, this is something that I dealt with that I think we've talked about, but what tips do you have for breastfeeding moms who go back to work? I mean, that can be a hard transition for some women.
It is a hard transition. The biggest thing is to begin pumping about 2 or 3 weeks. At least this is how I tell my patients, to begin pumping about every 2 or 3 weeks before, to start trying to build up the supply. You don't want to start pumping the day before and try and make what you need to make for the next day.
Right.
And then when you're at work, make sure that you're pumping as much as the baby would eat or as you're able to by your job. And what a lot of people don't realize is when they go back to work, they notice that there's a drop in their supply. But the stress of being back at work and pumping, that's going to cause it to drop just a tad, but it will come back. It's not a permanent drop forever.
Something we'll tell moms is, if you can, start at the end of the week. And maybe on a Thursday, and then you're there for a couple of days, and then you kind of recoup over the weekend, and now you've got the plan.
Right.
Yeah. That sounds like a good idea. Yeah. So related to that, you mentioned your milk supply will come back up. One question that came in off Facebook was they wanted to find out, are there certain foods they can eat to help keep their milk supply high? You guys ever recommend that, or do you say try to eat a balanced diet?
That's the main thing. Right. Now, I think one of the most common questions we get is, I have a low milk supply, what can I do to get it back?
Yeah, looks like that actually just came in from Elizabeth.
Yeah. And, there are different herbs where they talk about goat's rue or blessed thistle. There's been some mixed reviews recently on fenugreek. But there are different herbs that will help. One of the things we'll tell moms is after they feed, after they pump, to use hand expression, skin to skin with their baby. And then we also talk about power pumping in the evenings. So that is where you take 1 hour of your time, you pump for 20 minutes, rest for 10, pump for 20, rest for 10.
Okay.
Pump for 20. And
that sounds a little exhausting.
Yeah, but for 1 hour. Right. And to do it for a couple of days, it can really make an impact.
Okay.
And boost that supply.
Okay. What that power pumping does is it stimulates when your baby goes through like a growth spurt or is doing that nonstop feeding. We call it cluster feeding. So we're kind of recreating that, but we're recreating it with the pump. So is it exhausting and all work? Yes, but whenever baby is cluster feeding, it's also exhausting and a lot of work, and will benefit you in bringing that supply up as well.
Gotcha.
Another thing we even will tell moms is, what are things you can do to make pumping easier? Right. And that may make it less stressful. So by pumping hands-free, refrigerating pump parts for a couple of times and then cleaning them, that can help save some time.
Okay. So Hopefully those tips will help you, Elizabeth. You know, we do want to thank again Parkland Hospital as well as the Texas Breastfeeding Coalition for helping us promote this chat. We're getting some great questions. Keep them coming. And the last one, she just spoke of exactly what we were talking about. You know, she's tried fenugreek. It's not helping very much, but what did you call it? The active pumping?
Power pumping.
The power pumping. Okay, maybe that'll make a difference.
Well, and another thing that she might consider doing is making an appointment with IBCLC or an international
board
certified lactation consultant, and then she can go in and help and see, is this a latch issue that's causing you to have smaller? Is there something going on with her anatomy or the baby's anatomy that could be causing a low supply? And a lot of times when you see a lactation consultant, they'll have you breastfeed the baby there and can typically weigh the baby to kind of give you an idea of how much baby has actually taken in. And so while you may feel like your supply is low or not as high, then that will help kind of dispel that for you. And then if you're getting less by pumping, then you can add breast massage to your pumping routine. Similar to what Linda was talking about, because that helps to relax those mammary glands.
That's a good question. Now, one of the things that Lori asked, she says, and you know, I think a lot of people think that, you know, breastfeeding is all about the woman who's doing it, but she's asking, you know, how can my partner best support me during this time? Does that play a role?
Absolutely. Huge. In fact, research has shown that the biggest, greatest impact to being able to, for moms to be able to reach their goals is the support that they're receiving from their partner. So I like to encourage my dads, listen, you may feel like you're kind of left out of this whole picture, but you are one of the single most factors, or even moms, you're the single biggest factor that's going to help her to be able to achieve her goals.
And so why is that? Is that because, you know, they allow you maybe they take over chores that you would normally do so you can spend that time breastfeeding, or just the support that, you know, you need to go feed and take a break?
Right. I think breastfeeding is just very time consuming, especially in the beginning, and then you're so exhausted.
Yeah.
And if you don't have that great support, you can't do it by yourself.
Yeah.
And then, you know, us as women need to be able to vent. We need to be able to know that someone's going to go, it's all right. We are everybody's cheerleaders usually. So in that time, we need we need a cheerleader to go, no, I know you're frustrated right now. Let's keep going because it's so good for both you and the baby. What can I do to help? That's the easiest thing you can do. What can I do to help?
So it seems like, you know, after the breastfeeding was going down, it seems like now it's increasing in popularity and more women are doing it. Are you seeing that?
Yeah,
absolutely. Yeah.
So what is that? What does that tell you? I mean, why do you think there's an increase in women doing it in breastfeeding?
I think part of it is we know the value of breast milk and how important that is for babies and their health.
Well, that and then the support that we're receiving, you know, from places like UT Southwestern, like Parkland, like the Texas Coalition, that's really helping to put that out there so that parents are getting this information, whereas before it was more of a, well, this is how I did it, so everybody else should be fine too.
Right.
It's not us just we have the valid proof to show that this is an important way to try to feed your babies.
There's a lot more research now.
Breastfeeding. That actually came up. One of the comments when we were talking about this chat was somebody said, you know, my OB didn't support me at all, but that was 26 years ago. And so now it seems like there's much more proactive. But what about, you know, how soon after childbirth can somebody start breastfeeding? That was another question that...
Immediately.
Immediately?
Yeah.
So after delivery, we really encourage moms to put baby skin to skin with them. And normally, very fast, baby will immediately start picking their head up to try to find the breast.
To find it.
They can smell, and they will bob their head around like...
To find it.
Yes,
to find
looking. So... As soon as the baby wants to latch, let them latch.
Yeah.
As soon as the baby wants to. That sounds great.
And best practice is skin to skin after delivery, uninterrupted for 1 hour.
Right.
And within that hour, they should feed. Right. And sometimes it's sooner, sometimes it's a little bit later.
Interesting. So what about, and this is hard for some women, what about breastfeeding in public? Do you have any tips to help make them more comfortable or to help women with that?
For in public, the biggest thing that I tell my parents is to do what makes you feel comfortable. If you want to breastfeed in public and you aren't uncomfortable with it, then breastfeed in public. If you want to have a cover in public, then have a cover. If you want to go to your car, the only thing I say is don't go to a bathroom to breastfeed your baby, because I wouldn't enjoy eating my cheeseburger in the bathroom. So probably should avoid a bathroom. But but what makes her feel most comfortable.
Okay, avoid a bathroom. That's good advice there.
But even that the law says you can
yes,
breastfeed in public. So whether they do it discreetly or openly, they can do it how they're comfortable with doing it.
Gotcha. Okay. So let's see. So we've got Christy. She says, this is to you, Linda. She says, Linda, you helped initiate breastfeeding for my daughter and I when I gave birth 4 years ago. I successfully breastfed her for 2 years. I never got a chance to thank you, but thank you so much. I couldn't have done it without your help. So thank you so much, Christy.
That is awesome.
That's a wonderful accomplishment.
Yeah.
So
that is great.
I mean, 2 years, that's a lot. That's a long time commitment. I mean, I am very similar, but I'm wondering, do you see that more and more where women are kind of making a commitment to their children to breastfeed for that long?
Absolutely.
But I think certainly when they're newborns, when they're babies, but once they get to be toddlers, it may be a time or two a day. It may be a little bit more. It may be a little bit less. They may not feed for a whole day. So it really does change. But the security, I feel like that gives is you cannot replace it.
Right.
They come to you because they're very secure with you, their mother.
So we do have another question. What about leaking in public? That's kind of a
dun dun dun.
Yeah, exactly. It's like you're out in public, suddenly your shirt is wet.
Of course, there's lots of pads that you can wear. But even if you start leaking, you can put pressure on your nipple. I don't know how comfortable you'll be doing that in public, but you can put pressure on your nipple and it will stop the leaking.
Maybe that's when you go to the bathroom.
Right, yes. So, but yeah, you can use the little pads that are there, breastfeed the baby. If it's time to feed the baby, then you're going to possibly leak. So,
and even those pads hold about an ounce of milk.
Right.
Wow, that's a lot.
Yeah.
All right, so everybody, we've got about 8 minutes left. We're wrapping up, so now's a good time to get those last minute questions in. We did have one came in, and we addressed this earlier, but just to get back to it and reiterate it, what are the benefits of breast milk? What exactly does it do for the mom and the baby?
The antibodies that it gives to the baby, even if your baby is going to be staying somewhere else, you touch the things around where they're going to be, and you build the antibodies that protect the milk. Or that through the milk protect the baby.
Right. And for moms, it helps with weight loss, which is a big one for you after you've had a baby. But it also helps in reducing the risk for breast cancer, ovarian cancer. It helps in reducing the risk with osteoporosis. Osteoporosis.
Yes.
So there's a lot of benefits to moms, and especially for our moms who are at a higher risk for that. Our African American community, our Hispanic community, they're at a higher risk for that. So by breastfeeding, success, as long as they can, helps them in reducing that risk. Doesn't mean it's going to prevent it. We can't say that for sure, but it does help reduce it.
Okay.
And the longer you breastfeed, the more benefits you have.
Absolutely.
It's good to know. And we do want to recognize that this is National Breastfeeding Month.
Yes, it is.
And this is the Black Breastfeeding Week. And so it's a good time to have this conversation.
Right.
All right. So a couple more questions before we go. Let's see. And again, we've got about 5 minutes. So somebody says, that they, and this is not on here, this person emailed me privately, but she said, I want to give my son kind of the best possible health, but she really doesn't enjoy the process of breastfeeding.
Right.
And she's wondering, is it okay to pump? I mean, does the baby get the same thing?
Yes.
Absolutely.
Okay.
Breast milk is breast milk. It doesn't matter if the breast milk is coming out of the bottle or if the breast milk is coming out of the breast. It is still giving the baby exactly what they needed, and mom is still having the benefit of breastfeeding. Getting that stimulation.
Mm-hmm. Does it help then when she's giving the bottle of breast milk to keep with the skin-to-skin contact? Would that make it?
Absolutely. Even if she's exclusively pumping, she's still going to want to do skin-to-skin because that's a bonding thing as well. And it helps bring up those hormone levels in her own body that help
boost the milk supply.
Yes, that prolactin and all of those hormones that help.
Okay. All right. So to that person that sent me the email, you're in good shape.
That's
Don't worry. All right. So let's see. We've got a question from Elizabeth. Oh, it looks like it's more like a comment. She says, I had my baby girl in June at UT Southwestern and received so much help from the lactation specialist. Thank you all so much.
Good job.
Yay to you ladies. You're getting lots of kudos today. So let's see. We've got time for, I think, 2 more questions. Let's see. They are wondering, can you drink alcohol while breastfeeding?
Yes.
Yes. Okay. So
in moderation.
And if you do, and you feel the effects of the alcohol, then pump and dump.
Right.
If you have a glass of wine and 2 hours or 3 hours later you breastfeed, it's out of the milk.
Okay.
So.
Yeah, the alcohol is metabolized through the breast milk, very similar to how it's metabolized through your own body.
Okay.
So if you know you're going to have a glass of wine or a margarita or whichever you're planning to drink, breastfeed the baby right before. Then baby usually will be
asleep,
happy and fed, and then you've had your beverage, and by that time you should be fine. So as long as you're not feeling a buzz per se, then you should be
okay. All right. So let's see. We did. All these came in. If that always happens the last minute. Mandy, she says, I've been struggling with low supply since birth and have tried all kinds of supplements, goat's rue, fenugreek, all the stuff we talked about, and other ways to try to get it up with no luck. Is there any advice?
I really would. My biggest advice is to get in with a lactation consultant.
Okay.
Let them help you make sure that there is nothing going on with your baby's oral anatomy, that there's nothing going on with your anatomy, and that your latch is good. Latch is the number one key to being able to ensure you have supply, right next to making sure we're feeding frequently.
Okay.
If there is a poor latch, we're not able to empty the breast well. If we're exclusively pumping and you're not continuing to improve your supply, it could be that the flanges on the pump are too small. Or too big, but either way. So there's things like that. But unless we can see you and put our hands on you and look and see what's happening, it's hard to be able to see what's going on. You may not have low supply, but have that impression that you do. Okay. Or you could have low supply, and we could give you some tips from there.
Okay. All right.
And UT Southwestern does do outpatient lactation consults.
Oh, wow.
So if there was somebody that needed to be seen, we could get them in and take care of them that way.
That's good to know.
Even in the beginning when babies are sleepy, we use a lot of hand expression.
Absolutely.
And bring out the colostrum and spoon feed it.
Oh, wow.
If they're too sleepy to feed at the breast.
So cute.
Yeah.
But that impacts the milk supply for the long term.
Right.
So.
All right, so we've got a question from Erin. She says, how much milk is needed for the baby to receive antibody benefits? I have the perfect storm of low supply and preemie twins with poor latch.
Oh, yeah.
Sounds like a challenging situation, but congratulations on your twins.
And keep fighting.
Yeah.
Any amount is a good amount.
Yeah. And any amount makes a difference.
Right.
So any amount has those antibody benefits that she's asking about.
Well, and another thing that they can do is, even if it's a tiny, tiny amount that they're able to get, they can use it for oral care for the baby while the baby's in the NICU. And then they're still getting that the nutrients, the taste, they're getting some of the things that they're needing from mom, just from the oral care itself.
Interesting. All right. So you're doing okay, Erin.
Yes.
Keep it up.
Keep going. You got it.
Let's see. We've got time for one more question. We're going to take this one from Brianna. She says, "How do you recommend weaning a 21-month-old? And what's the best way to go about that? Is it that step-by-step that we talked about a little bit?"
Yeah.
Yeah, but she's probably already there. Okay, this is something. There was a book written many, many, many years ago by Karen Pryor. It's called Nursing Your Baby. And she thinks, in that book, she said, to put a little bit of vinegar on the nipple when you have a toddler that you're trying to wean. And then you can say to them, oh, the milk's gone bad. So, and then they choose not to feed. You're not telling them they can't do it.
Yeah.
Because at 21 months, it's obviously not a nutritional need. I mean, it's good for them.
Yes.
But it's a comfort. It's one of those things that they know it's special for them. So
and sometimes the mother is ready.
Yeah,
and that's a good way to do it.
Yeah,
absolutely.
Yeah. So hot sauce on the
vinegar.
Vinegar. Yeah, don't do that.
They know the smell is not that good.
Okay. All right. Well, ladies, I think we are out of time today. But I want to thank everybody for tuning in and all the great questions we had for Mandi and for Linda today. And, we'll be coming back starting, I think, next week with more chats for the rest of the month. So keep in tune. And in the meantime, thank you both so much for joining us.
Yes, thank you.
All right. Have a great day, everybody.
Bye.